Hello, good evening, and thanks for joining me tonight. We've got a great show for you. We're going to leave you feeling inspired and educated. Also, we're going to let you know about a couple of things. Organ donation, we're talking about that today. And you're going to meet a doctor who is going to Africa to teach kids to read, and he's local. He's from right here. But first, we want to start the alert with inspiration. It's a story about a woman who's continuing to live with cancer and fighting to keep a smile on her face and on the faces of total strangers. This is Alina Taylor. She was diagnosed with breast cancer 4 days after her 40th birthday. Her cancer, very aggressive, and she was immediately put on chemotherapy. Fighting the disease, though, was a no-brainer for this mother of 4. But instead of being depressed and discouraged about her cancer, she decided to give back to other patients at the Comprehensive Blood and Cancer Center. Along with her wonderful children, she put together small gift packets to support the patients during their time with chemotherapy. And while handing out these goodie bags, she also spread joy to those around her. Please welcome Alina Taylor and her doctor, Ravi Patel. Thanks to you both for being here.
Thank you. Thank you for having me.
Absolutely. Alina, most importantly, how are you feeling today and where are you at in your treatment?
Well, I'm feeling good. Today's a good day. We can count them in good and bad days. I'm round 4 of chemo, and I'm overall feeling really great. Feeling very optimistic. Have a great doctor, a great family, great support system. So I'm feeling great and hopeful.
What inspired you to make these goodie bags, and what exactly did you put inside them?
Okay, well, I brought one here. Yes.
Move the computer.
That's okay. Inside there, well, the reason why I thought this would be a good idea, because I'm kind of, maybe as a mother, I always I want to help someone, and you know, I'm one of the younger ones in there, so I'm always the one like, oh, let me help you put your chair down, or let me help you, but I'm also tied up to, you know, my chemotherapy also. But I just know that sometimes people are sleepy, people need a nap, and so that's why we put the eye mask in here.
I love it.
And the earplugs, because there's a lot going on in there, and then just some tissues, because many of you don't know, you lose the little hair in your nose as well, and then just some gum that will help by the time or as they flush your portacath or something like that is needed. So I'm just hoping to give back, helping to make someone you know, happy if they need someone there.
It's so funny. I know I've never been through chemo, but I watched my mom go through it. And whenever they flush her portacath, they're like, "Do you taste the thing in your mouth?" There's a weird taste in your mouth.
Absolutely, it's awful.
So the gum is important.
Yes, you have to be ready for it. You're like, oh, a little bit too late.
Oh, well, this is perfect. And what a thoughtful thing to do. Dr. Patel, have you ever had a patient do something like this? And what does it mean to the other patients?
Well, you know, the one good thing is that Elena thought about others, and I think, you know, that's an inspirational thing for us.
Yeah.
It's always interesting, you know, when you come to that point in your life when you realize that, you know, you have a very serious life-threatening illness. You really start connecting with others around you.
Yeah.
And it's beautiful to see. A lot of people have negative ideas about cancer, but the great thing is it's somehow a great connector. It just dissolves all barriers of, you know, race, age, a variety of different things. Once you go into the treatment room like Elena does, it's just everybody is part of your family, and you're connected, you know.
I'm sitting next to this beautiful young woman here,
Thank you.
40 years old and diagnosed with cancer. That is seemingly young, isn't it?
It is. And you know, there's 2 misconceptions. One is you have breast cancer, you need to have surgery right away. No, sometimes that can be a negative outcome. So you need to really look at the kind of cancer. Elena had a very aggressive cancer, but there's 2 very powerful new drugs which we can use in a combination, which can shrink a cancer and increase the survival. So that's important. And young ladies at the age of 40 need to definitely look into the possibility of regular self-breast exams. And some insurance companies deny mammograms at the age of 40, which is not right. You have to, at the age of 40 and even before 40, do a regular breast self-exam. Make sure that you examine yourself. We see young people with cancer on a regular basis.
Wow. How often should people be doing these self-breast checks?
They should do it at least once a month, and you should start even at the age of early 20s, you know, and then keep on going, and then be sure you get your baseline mammogram at 40. And also remember that when you have breast cancer, it's important to remember that But it's not just surgery. It's a team approach where sometimes you have to give treatment first to shrink it and do surgery. Like in her case, we would have had a negative outcome if we did surgery first.
Really?
She needed the treatment first to increase her survival. And she's doing extremely well. And we're happy to see her sharing a joy in life with others. You know?
Yeah. Well, thanks so much for being here.
Absolutely.
I have to ask you before we wrap up, you've got your beautiful daughter on set here with us tonight, but what is, when you're faced with those dark times, what pops in your head and what inspiration can you give to others?
Well, it's really family. You know, as a mother, we kind of have always done everything for our children and
Right.
everything else. Cancer makes you step back and have to, you know, allow others to give to you. But my inspiration is my family,
Yeah.
because I want many, many more years with my family, with my husband, with my school children, with everyone around me. That my big support system. I've told many people that it takes a village to have cancer, because there's just so many help between the doctors and the family and the help that is given. And so obviously my family is my inspiration to keep on and to have a positive attitude, because it is true, you could just be negative about it, but it's just a bump in the road. You have to go through it. It's just an attitude that would make the difference.
And I have to say, I said it before, but you look absolutely beautiful.
Thank you.
are
Thank you.
showing that it...
Embracing it.
Yes. And Dr. Patel, final question to you. You've introduced me to so many beautiful, wonderful patients of yours. Why is it so important to keep a positive outlook?
Very important, because you know, healing is not just chemotherapy. It's the whole self, and you need to have your inner self also enriched by the beautiful things you do,
Yeah.
think about, and people you meet. So I think it's important to have a tremendous attitude, because you know, you don't get the best cards in life all
Yeah.
the time, and you have to play the cards you have very well. So you know, you just play them well, and look at what she's done. You know,
Yeah. Well,
she's playing them well.
Wonderful. I love that reference, an analogy right there. All right, thank you, Dr. Patel, and thank you, Alina, for being
Thank
here.
you.
So important. Well, continuing our women's health coverage.